Hello everyone, welcome back to Homeo Vision. This is Dr. Kiran. I will be dealing with the AIAPGT 2021 Repertory previous year question today. Okay, so as I already dealt with the AIAPGT 2022 as well as 2023 questions. Okay, so you might have got an idea regarding the question on which the repertory questions will be based, right? So before I move on to the actual topic, I'll be dealing with what are the high yield areas or the high yield question that can be probably asked in the repertory in the repertory AIPGT 2024. Okay, so as 16 questions has been allotted for repertory subject. Okay, so the areas which are very important or you need to know with respect to AIPGT 2024 is construction of the repertory, arrangement of chapters, gradations, number of remedies, year of publication, rubric hunting, mind rubrics, as well as the single drug rubrics. So these are the areas of interest of the examiners, so in which they frame questions accordingly. At least the construction, arrangement, chapters, number of remedies, year of publication, rubric hunting, mind rubrics, single drug rubric, all these aspects or all these topics should be very thorough with respect to Kent repertory, BTPB as well as BBCR repertory. Okay, so moving on to first question, the rubric for cracking of joints is given in which section of BTPB? Okay, so whenever you read the question, so always be very thorough with what repertory they are asking the question on. Okay, so the question is they have given they have mentioned the rubric, we need to identify the chapter. Okay, so aggravation is quite ruled out because it's a general aggravation, and cracking of joints is nowhere related to the aggravation. And then the only probability you can suspect is extremities or sensation. Okay, so in extremities chapter more with respect to particular specific joints is given, and in general it is not given. Okay, so the right answer is, if you see the Boningosson therapeutic pocket book, under sensation chapter you have cracking of joints rubric. Okay, so the right option is sensations. Moving on to next question, the year of publication of synthetic repertory is 1973, 1987, 1993, 1996. So this is a question based on a modern repertory, so which is synthetic repertory. Okay, so always read the question twice. I've been repeatedly telling this again and again. The reason why is because one simple mistake may lead to great disaster, and you may lose a seat in a government or a central government institute. So synthetic repertory is a modern repertory. Okay, this is not synthesis, it is synthetic repertory, and we need to know in which year the synthetic repertory is published. Okay, under that there are four options. I'll be dealing with all the four options. In which particular year which particular repertory is published, I'll be dealing with it. So here this is the synthetic repertory where it has 3 volumes. Okay, so it is written by Barthel and Clunker. So the first volume is written by Barthel. Okay, so under these 3 volumes repertory, okay, though it is based on a Kentian repertory, it was published in 1973. So after the Kent's repertory, whatever repertories has been published, it is called as post-Kentian repertory, and these are the repertories which are post-Kentian as well as the modern repertory. So in 1973 synthetic repertory is published, whereas synthesis, so synthesis it's the 5th edition. Okay, so 5th version is published in 1993, whereas synthesis as well as the homeopathic medical repertory, so the picture I have given is the 3rd revised edition, but the first homeopathic medical repertory, the first edition was published in 1993. Synthesis as well as homeopathic medical repertory by Robin Murphy, or what we call it as Murphy's repertory, is published in 1993. Okay, so and then the complete repertory is published in 1996. Okay, so the right answer is 1973. So since it is synthetic repertory, the right answer is 1973. Okay, moving on to next question, the medicine given in Kent's repertory for hair fall during pregnancies. So this is a little tricky question, because what happens, majority of the aspirants, they try to answer this question based on their previous knowledge or the remedial mathematical knowledge. Say for example, so we know hair fall, there are many remedies. We have phosphorus, fluoric acid, natramure, sulfur, lycopodium. Okay, so but we are not very much aware of the lachesis. Okay, so that is why even if you see, it's a more twist question, because we have many twisty option, and then you may end up in answering the wrong option unless and until you have not went through the repertory thoroughly. Okay, so if you answer this question, there are chances you might get this answer wrong. Okay, so the only remedy in the Kent's repertory under head hair falling pregnancy during. Okay, so pregnancy during is the sub rubric here. So in the under that you have only single remedy is lechesis. Okay, so the option A, lechesis, is the right answer. Moving on to next question. The symbol mathematical pi in Knerr's repertory indicate. Okay, so Knerr's repertory, as you know, there are two Puritan repertory where the symptoms or the rubrics of the patient as it is mentioned in the repertory. Okay, so Knerr's repertory is again based on Herring's guiding symptom. The entire 10 volumes of Herring's guiding symptom has been compressed into one single volume, and then it has been published by Knerr in 1896. Okay, so under that there are many, after some remedies, there are some signs mentioned. Say for example, cross reference is mentioned with hand sign, and T is mentioned for toxicological extract. Okay, so whereas pi symbol is mentioned for symptoms observed in sick only. Okay, so these are the symptoms whenever you find a sign pi in the Knerr's repertory. Okay, so under the symptoms observed in sick only, so that means these are the symptoms which are only observed in the sick. Okay, so you have to remember it is the pi. And then moving on to next question. So this is a statement based question. Okay, so as I already dealt in the previous video as well, there will be two statements. Okay, so in which you need to know the entire statement correctly, and you should associate with statement 1 whether you should tell it is true or is it false. Okay, the foundation of Boninghosen therapeutic pocketbook is doctrine of concomitant. It is that which gives the book its peculiar value. Okay, and a separate section of concomitant is given in all chapters of therapeutic pocketbook. In the light of the above statements, choose the correct answer from the option given below. So you need to say whether it is both are false or both are true, which one is true or which one is false. Okay, so the question is quite clear because I already dealt in the previous videos many statement 1 and statement 2 based question. Okay, let's see the statement 1. The foundation of Boninghosen therapeutic pocketbook is doctrine of concomitant. This is the peculiar value of the book. Okay, so as you know, this is BTPB. Okay, so Boninghosen was the first person who told about concomitants. Okay, so he didn't actually mention the word concomitants, but he told the unreasonable attendance. So it is nothing but the keynote symptom. Whenever in a complete symptom, concomitant is nothing but whenever the particular symptom is not related to that exact symptom. Say for example, we have many concomitant symptom mentioned in BTPB. Okay, so definitely it is and even in the 4 fundamentals, LSMC, location, sensation, concomitant, and modalities, you have concomitants which is mentioned in a very peculiar manner, and this is the uniqueness of the BTPB as well. And Boninghosen, though he was the father of repertory, and he was the first person who coined the term unreasonable attendance. Okay, so which is nothing but concomitant. So the statement 1 is true. And if you see the concomitant, second statement is they mentioned that concomitants is mentioned in the BTPB. In the end of every chapter, concomitants is mentioned. Okay, so this is the question. A separate section of concomitants is given in all chapters of therapeutic pocketbook. So let's see whether it is mentioned in all the chapters of therapeutic pocketbook. End of all the chapters, whether concomitants is mentioned or not. So in the BTPB, it is not mentioned. Okay, so whereas in the BBCR, concomitant chapter is mentioned in majority, concomitant section is mentioned in end of the majority of the chapters. So if you see BBCR, there is a particular pattern. Say for example, after some, say for example, head chapter, so there is time modalities, aggravation, amelioration, and then ultimately the concomitants is also mentioned. Okay, so this is what this one is mentioned. So whereas in BTPB it is not mentioned. So the statement 2 is false, statement 1 is true. Moving on to 6th question. The rubric for presbyopia is available in repertory and chapters as. So there are 5 main headings. Under that you need to select in which repertory and in which chapter the presbyopia is mentioned. Okay, so if you see Kent vision, Kent eye and vision, therapeutic pocketbook vision, BBCR head, BBCR eye. Okay, so you need to know in which you need to know. So for this particular rubric you need to know all the three repertories. So for example Kent, BBCR and BTPB. Okay, so in which chapter the presbyopia direct rubric is mentioned. Okay, so here in the option you have A, C and D only, and then you have B only, D only and E only. So this is a multiple repertory question where you need to have knowledge of all the three repertories. But it's a quite simple question because so if you know presbyopia, again it's a age related accommodative disorder where you have a gradual loss of ability of the eye to focus on the nearby object. Okay, so this is what the image is showing, and this is what the patient present also. So in the BBCR you have the direct rubric under eye vision presbyopia. Okay, whereas it is not present in any of the repertories like Kent and BTPB. So the right option is E only. So this is the only rubric. Presbyopia is only mentioned in BBCR. Eye, under eye there is vision, under that there is presbyopia. Okay, so moving on to next question, match list 1 and list 2. Okay, so there are two lists mentioned here, so always read the question again and again. Be very thorough with what they are asking, and be very thorough with what options you mark. Even after marking the option, you make sure you re-verify once again. Okay, because in this question list 1 is nothing but the repertories, list 2 you need to match the author of the repertory. Okay, so if you see here in the out of 4 questions, all two are equally confusing. Say for example there is Kent's final general repertory and Kent's repertorium general. Okay, so if you know only Kent repertory, then this is not the question for you, so you might need to quit. But I always tell match the following options will be always suggestive, and if you are able to rule out the questions, then again it will fetch you good number of marks and it will help you in getting good ranks as well. So and then the other two repertories are synthetic and synthesis repertory. Okay, so here Kent's final general repertory. Okay, so as I will only solve with option B and C first, that is synthetic repertory and synthesis repertory. Synthetic repertory, in the beginning of the video I already told the author is Barthel and Clunker. Synthesis repertory, it is nothing but your app version, and you also see it in radar. Okay, so it is written by Frederick Stroyens. So option B is 2. Okay, so and option C is 3. So B2 and C3, so if you it's quite easy to rule out now, so because only remaining option is option A and option D, because B2 and C3 is common in option A and option D. Okay, so then Kent's final general repertory and Kent's repertorium general. Okay, so Kent's final general repertory is the very revised edition of Kent's repertory, now where the manuscripts were stolen, and you might have heard in your UG repertory classes. So Perry Smith and Diwan Harishchan from the India, they tried to collect the manuscript and they published the repertory. This is nothing but the Kent's final general repertory. So the option A stands for list in the list 1, option A stands for list 2, option 4. Okay, so then obviously Kent's repertorium general is published by Guernsey. Okay, so the correct answer is option D. Okay, so A4, B2, C3 and D1 is the option. Then how will you arrange the rubric representation in Kent's repertory for a person presenting with left-sided sciatica? So as you know, it's a here the question is based on Kent's repertory, and you need to arrange the exact rubric which is mentioned in Kent repertory. Okay, so and if you see the options there, so sub options like main pain extremities, sciatica, left lower limbs, so it's very clearly mentioned that. Okay, so it's a chapter wise, the chapter is in extremity. Okay, so if you see Kent repertory, so this is the sciatic nerve, which starts from the lumbar and sciatic nerve roots and the sacral nerve roots, and again it end up to pain in the posterior aspect of the thigh extending to the toe. Okay, so here the right rubric is extremities, right arrangement is extremities, pain, lower limb, sciatica, and they also mentioned the side. Okay, so as you know, the in Kent's repertory STME pattern, so first is the side, under side they are given left. So extremities, pain, lower limb, sciatica, left is the right answer. So the right answer is B, A, E, C, D. That means extremities. Even though you know the answer, this option marking should be very perfect so that no will not jumble with the options given here. So the right answer is option 1. Moving on to next question. Question number 9. So here again it's a question based on rubric hunting, where they have given the symptom or the rubric in which chapter it is mentioned you need to tell. So it's a question based on Kent's repertory. Abducted lies with limbs is mentioned in which chapter? Okay, so this is a quite easy question. The only thing you'll get confused is because so lies with the limbs is given, so you either confuse it with the sleep chapter or it is with the extremities chapter. Okay, so if you see lying, of course there are many sleep position given in sleep chapter, but here the right answer is extremities. Okay, so under extremities you have abducted lies with limbs. So and this is the first rubric in extremities chapter of Kent's repertory. Moving on to next question. Awkwardness is mentioned in which chapter of Kent's repertory? Okay, so what is awkwardness? Okay, so it might be a mind symptom in many of the other repertories, but here the awkwardness is mentioned in the extremities chapter. That means extremities awkwardness, it's a very vague position of the extremities. Okay, so that is why it's mentioned awkwardness in Kent's repertory is mentioned in option B, extremities. Okay, then moving on to next question. Pain in abdomen. Again, this is a question based on Kent's repertory. So in AIAPGT 2021, there were 3 rubric hunting question from the Kent's repertory itself. Okay, so and that too in different section of Kent's repertory. So because majority of the time we focus on the mind section of Kent's repertory, but here they have given in different sections of Kent's repertory. Say for example, I told previous extremities, then the abdomen. Okay, so there are different areas where you need to mention and you need to be knowing also. So pain in abdomen, menses appear as if. Okay, so since the menses is given, majority of the students have attempted it wrong. They have mentioned it either female genitalia or genitalia. Okay, and sometimes it can be generalities as well, but the right option is, so pain in abdomen, menses appear as if. Okay, so this is quite similar to dysmenorrhea. So whereas in Kent repertory, the rubric for dysmenorrhea is mentioned in female genitalia, menses. Under rubric menses there is painful. Female genitalia, menses painful is the rubric for dysmenorrhea, whereas pain in abdomen, menses appear as if is mentioned in the abdomen chapter. Okay, option A, abdomen is the right answer. Then sucking the thumb is mentioned in which chapter of BBCR repertory? So this is again a rubric hunting question from the BBCR repertory. So in the previous video I have dealt with the AIAPGT 2022 repertory previous year question. In that there was the same question mentioned in a match the following form. Okay, so sucking of the thumb, especially it's a, as I told in the previous video, so it's a rubric based on children. Okay, sucking of the thumb in children is mentioned in upper extremities chapter. Okay, you have constitutions like calcarea foss, you have Silesia child. Okay, so the right answer is option D, upper extremity. Then moving on to next question. Abortion is mentioned in which chapter of Boninghassen therapeutic pocketbook? And because you can't remember all the rubrics and all the chapters of all the repertories, so you need to know, you need to be little smart. Okay, as I already mentioned it again and again, that there are questions where they keep asking, there is a tendency to ask questions from the misplaced rubrics of Boninghassen therapeutic pocketbook, and the abortion rubric is mentioned in misplaced rubric. Okay, so some of the misplaced rubric which is mentioned in Shashikant Tiwari, you should be knowing it completely. Okay, so the right answer is menstruation. Okay, so you can see here there are many other misplaced rubrics as well, where you have anus, hemorrhoids, rectum, perineum. Misplacedly it's mentioned in the stools chapter. They also have abortion mentioned in menstruation chapter, vertigo in mind and intellect chapter. Okay, all the misplaced rubrics should be known at the tip of the tongue, so that immediately when you see a question based on BTPB, majority of the time you always try to rule out whether this is a right rubric or it is a misplaced rubric. So the right answer is option B, menstruation. Then match list 1 and list 2. Okay, so here the list 1 is the list of rubrics from the BBCR and list 2 is the chapters from the BBCR. So we need to match the rubric with the exact chapter. Okay, so let's see what is the easiest rubric in the list A first, and then we try to match it. Okay, so sinusitis, as you know, it's quite often associated with rhinosinusitis. So option under list A matches with the option 2 of nose. Okay, so option A, so A is 2. Okay, so if A is sinusitis is the right rubric mentioned in the chapter nose, then the A is 2. That means option D is ruled out, because in the option D they have mentioned A3. So you need to rule out between the other 3 things. Okay, and hemophilia, in the previous video I have dealt that no, hemophilia is mentioned in sensation and complaints in general, because it's a pathological general where there is a bleeding tendency in joints, in anal openings. In normal, it's kind of scurvy symptoms are mentioned where there is gum bleeding. Hemarthrosis are mentioned in hemophilia. So hemophilia is seen in sensation and complaints in general chapter. So A is 2, C is 4. Okay, C is for again. Now you have ended up in two narrow option, that is option A and option B, where A is 2 and C is 4. Okay, so and then now the main confusion is between emotions and nervous exhaustion. So how do you relate now? Because majority of the mind chapters of Kent's repertory, many emotions are mentioned. You might have studied in UG as well. Whereas nervous exhaustion can be given in aggravation and amelioration chapter. Okay, if you are having guesswork, it will lead to a wrong answer here, because in the conditions of aggravation and amelioration in general, it is not just the physical symptom. Okay, there are many mind rubrics also mentioned which causes aggravation in general as a person. Okay, many mind rubrics like emotion, anger, okay, so and then jealousy, all these kind of rubrics are mentioned in aggravation and amelioration in general. Okay, so the option B under list A is again option 3 in under list B. Okay, so the answer is B3. Okay, so next, of course, the last remaining is nothing but nervous exhaustion is again mind. So the right option is option B. Okay, so option B is the right option. So here there is one more question based on list 1 and list 2 of the Kent's repertory. Okay, so here in the Kent's repertory, it's not just in general Kent repertory, but the list of repertories are mentioned, and under list 1 there are list of rubrics. Okay, so you need to match the right rubric to the right repertory. Okay, so here at least you should be able to know, because it's a little quite tough question. Unless and until you are not seeing repertories in and out, not consulting repertories in and out, so this will be a very difficult question to answer. So under list 1, so at least I could remember that pyromania is nothing but setting fire. Again, it's you have a single remedy rubric Heparself there in BBCR repertory. So B I could trace it as 3. Okay, so B I could trace it as 3. So if you see under which option the B is mentioned as 3, there is option 3. Okay, so the right option is option 3 here. So see, because whenever the question is very difficult, so the option of choosing the right answer will also become less, and probably majority of the students who have left this question might have also gained a mark. Like, even if you don't get a positive response, if you are preventing yourself from getting a negative mark, that again itself is a bonus in AIAPGT 2024. So pyromania is given in BBCR, and then aggravation from wrong position is given in BTPB of aggravation chapter. Molluscum is given in boric repertory, and aura epileptica is mentioned in Kent repertory. So the right option is option 3. Okay, so A2, B3, C4 and D1. Okay, moving on to 16th question. Given below are two statements. One is labeled as assertion A and other one is labeled as R, which is mentioned as reasoning. Okay, so this is a question based on assertion and reasoning. That means, see, in the previous question I have dealt with statement 1 and 2. So there you need to mention whether the statement is true or false. Okay, if you are very clear with that ideology, it's very easy to answer either it is true or false. But here in the assertion reason, So you have to know whether the assertion and reasoning is right or wrong. Along with that, is there any association between assertion A and assertion R? Reason R is also mentioned in this particular question. Okay, so for example, all medicine under chapter extremities, heaviness, lower limbs, exertion after in Kent's repertory are mentioned in first grade. Reason are rubric pain is not present in stool chapter of Kent's repertory. Okay, so first thing is whether we should know which one is right and which one is false. First, let's see the assertion part, where because this is a question which is mentioned in AIAPGT 2022 as well. Okay, this question I have already dealt in the previous video. If you can see this is again a repeated question. The reason why I am doing previous year question is because majority of the question may arise from the previous year question. Okay, and this is the only blueprint you have for appearing for AIAPGT as well. And then if you see here, so under extremities, heaviness, lower limbs, exertion after, you have 5 remedies: conium, gelsemium, lachesis, picric acid, rustox. All are mentioned in first grade. So that means assertion is true. Okay, assertion is nothing but statement 1. It is true. And if you see reason, rubric pain is not present in stool chapter of Kent's repertory. Okay, so where do you expect pain in? Usually pain in anorectal area. In which chapter do you expect? Obviously you expect in rectum pain. Okay, even rectum hemorrhoids painful, direct rubrics are there, but in the stool chapter rubric pain is not mentioned. In the stool chapter only the character, color, consistency of the stool is mentioned, the shape of the stool is mentioned, whereas the pain is not mentioned. So that means assertion is true and reason is false. Okay, no, the rubric pain is not present in the stool chapter. Even the reason is right, but there is no relation between assertion as well as the reason. So that means both A and R are true. Okay, and R is not the correct explanation for A. So correct answer is option D. Okay, so you should always have the tendency to get confused in this kind of question. Okay, so as I told, assertion and reasoning questions, you should always relate whether the first statement has any relation with the reason statement as well. Okay, so that is the most important thing, and majority of the time, even if you don't know the right answer, okay, so then it again becomes difficult to analyze correctly the rubric as well as the assertion and reasoning things, and that will again end up in losing marks. Okay, even if you are aware of that question, you may have the tendency to lose mark in this particular question. Okay, moving on to next question. Loss of appetite belongs to which class of symptom? Okay, so here this is the last question. No, this is the last but one question. Okay, so here this can be also a question of organon of medicine, but because this is a symptom classification question and each and every symptom is helpful for the selection of the rubric, I have mentioned here as 4 option. Okay, so here Bonning-Osson's complete symptom. So what are complete symptom? Okay, Bonning-Osson complete symptom, as you know, it is location, sensation, modality and concomitant. Okay, loss of appetite will not hold good with respect to complete symptom, because location is not given, sensation and modality is also not given, so that is ruled out. And Garth-Boric determinative symptom. So for this you should know the Garth-Boric classification of symptom. Garth-Boric has classified classified symptoms into 2 symptoms. One is basic symptom and next one is the determinative symptom. So determinative symptom is uncommon symptom and basic symptom is the common symptom. So loss of appetite, since it is more of a common symptom, it's not mentioned as a determinative symptom. So option B is ruled out. Option 3, Hahnemann's general symptom. Okay, so you should be remembering this particular symptom as very important symptom, because Hahnemann general symptom are the common symptoms. Okay, whereas Kent's general symptom are physical and mental general symptom. Okay, so I repeat once again, Hahnemann's general symptom are common symptom and Kent's physical general and mental general are the general symptom. Okay, so Kent classified general symptom in 2 different ways, mental as well as physical, whereas for Hahnemann general symptom is a common symptom. So option C is the right answer. That means loss of appetite belongs to Hahnemann's general symptom. Kent's particular symptom, as you already know, it's the part of the body which is affected. So for example, extremities pain or head pain, so this is a particular symptom, And under Kent's classification, it is characteristic particular. So since it's just mentioned as a particular symptom, loss of appetite has no role to play with particular symptom. So option D is ruled out. The right answer is Hahnemann's general symptom. Okay. Moving on to last question. So this is a very basic UG question where you might have learnt about repertory in the fourth year of your BHMS. So this is a question where Bonninghausen's concept of Quibus auxiliis signifies the options. Okay, what does it simply means? What does Quibus auxiliis means in the below symptom? Okay, so whether the answer is causes of the symptom, concomitant symptom, whether it is modalities or the seat of the disease. Okay, as you already know, the Bonninghausen's hexameter. Okay, quis, quid, ubi, Quibus auxiliis, cure, comedo and quando. Okay, they have mentioned about the Quibus auxiliis, that is nothing but the concomitant symptom. So the right option is option B, concomitant symptom. Okay, so these were the questions of repertory AIPGT 2021. Okay, so here in 2021 there were majority of the question. Okay, so it's for example in this year they have mentioned nearly 17 to 18 questions from the repertory, but since there is already a very fixed blueprint for AIPGT 2024, 16 questions are mentioned under repertory section. Okay, so repertory subject is a very important subject, especially for people appearing for AIPGT, because it's little tricky, but it's quite easy to score marks as well, because out of 480 you can score 64 marks completely. Okay, so even even you can score the complete, like all the 16 questions you can score complete marks, not even letting go of a easy question, or say for example even the tricky question you are able to answer it rightly, you can fit 64 marks completely in the repertory section. So I always tell study previous year questions first, and then you go on to the try to brush up the other basics of repertory. Say for example evolution of repertory, year of publication, and then the gradation of different repertories. And whenever it comes to mind rubric hunting, so as I mentioned in the first slide of this presentation, it's quite clear that they are always asking from rubric hunting from the basic repertory like BTPB, BBCR, Kent repertory. So be thorough with Kent's repertory, be thorough with BBCR and BTPB repertory. Different chapters, always compare and study. It will again help you to fit seat in a central government institute like NIH Delhi and NIH Calcutta as well. So and all the best for your AIPGT exam. Thank you. Hello everyone, this is Dr. Kiran. Welcome back to Homeo Vision. So in the previous video we have been dealt with AIPGT 2023 repertory previous year question. In this video I will be dealing with AIPGT 2022 repertory previous year question. Before I jump on to the actual topic, as you all know, in the AIPGT 2024 repertory has been allotted 16 questions. Okay, so that means 16 into 4, you nearly have 64 marks get allotted if you get the repertory questions correctly. Okay, so considering that in mind, what are the key areas of the focus for the examiner to ask the questions can also be judged based on the previous year question. Okay, so one common area is rubric hunting. Okay, rubric hunting is the most common expected question in the AIPGTs. Even it will be helpful for your clinical practice as well, because once the patient tells the symptom, you should be in a state to convert it into right rubric and the exact rubric. Okay, so considering AIPGT in mind, though we have many repertories, the usually trend of asking the questions is from the basic repertories, that is BBCR, BTPB as well as the Kent repertory. Okay, so rubric hunting is one area of focus, whereas the second area is single drug rubric from various chapters of it can be mind, or it can be generalities, or it can be other parts of the body. Based on the examiner's interest, they may ask question to identify the single drug rubrics in all the three basic repertories like BTPB, BBCR and Kent repertory. Okay, so let's move on to the first question. So first question here is, arrange the following subchapters of urinary organs of Kent's repertory in order of their appearance from the first to last. So they have asked here the question is about the arrangement of the urinary organ chapter of Kent's repertory. Okay, so it's actually a very easy question if you would have gone through, if you would have glanced at the Kent repertory many times, this would be an easy question. Okay, so there are 5 options we should which again contains inside the urinary organ, like urethra, urine, bladder, kidney and prostate. So this is a very easy question if you know the arrangement of the urinary organs of Kent chapter. Okay, so in Kent repertory, if you know that urinary bladder is actually alphabetically arranged. Okay, so that means in the alphabetical order the chapters are given. Okay, so even in your AIAPGT, if the question is how many chapters are there in Kent repertory, if there is an option to write it as to mark it as option number like 33 chapters, you can go for it. If there is no 33 chapter, your answer should be 37. Okay, because urinary bladder has been split into 5 different subunits. Okay, so here the question was in what arrangement the bladder chapter, urinary organ chapter has been arranged. Okay, so here if you see the repertory, so the first chapter is bladder, then kidneys, then prostate gland, then urethra and then urine. So it is alphabetically arranged. So it's a quite easy question to score good marks here. Okay, so the right answer is option C. Okay, so moving on to next question. Orgasm of blood is mentioned in which chapter of Kent's repertory? So again, this is a question from Kent's repertory. So there are 4 chapters given or 4 options. We need to identify the right option. Okay, so and majority of the students who have attempted AIAPGT 2022 have got this question wrong, because they think orgasm of blood is in female genitalia chapter. Okay, so which is a wrong notion. Here when you see the Kent repertory, under generalities you have orgasm of blood. Okay, so orgasm is also related to symptoms like congestion or increased blood flow as well. So that is why it is given in the generalities chapter, orgasm of blood. So the right answer is generalities chapter. Okay, so moving on to next question. Question number 3. Which of the following rubrics are present in BBCR repertory but absent in Kent repertory? Even in AIAPGT 2023 there was a question very similar to that, where you need to find the rubric which is absent in Kent repertory but present in the BBCR repertory. Okay, so there are 4 options given. Okay, so let's see whether in which chapter the right rubric is actually given. Okay, so in the BBCR chapter, okay, under sensation and complaints there is a rubric reflexes diminished. Okay, so that is ruled out actually. Okay, so reflexes diminished is present in BBCR chapter. Okay, so then you need to see the next rubric, that is satyriasis. So satyriasis is seen in BBCR chapter under sexual impulse. Satyriasis is nothing but the increased sexual desire in males. Okay, whereas in females it is called as nymphomania. Okay, so this rubric is not there in Kent repertory as well. So whereas the next rubric, sucking of the thumb, is directly given in the upper extremity. So this is a quite common rubric with dealing with the children. So we have children like calcarea first child, also Silesia as a rubric. Okay, you have chamomilla, you have sulfur. So this rubric is given in BBCR repertory. Okay, whereas the other 2 rubrics in Kent repertory, okay, hysteria. Okay, so hysteria is the most common mind rubric we use in day in and day out of the practice. So hysteria is mentioned in Kent repertory but it is not there in BBCR repertory. Okay, so here the next one is the imbecility. Okay, imbecility is nothing but stupid or an idiotic person. Okay, so imbecility is also given in, you can remember one remedy, Beretta curve here. Okay, so these are the two rubrics where you can see in Kent repertory but it is not found in BBCR repertory. Okay, so the answer is option 4, A, B and D only. Okay, so moving on to 4th question. Arrange the following chapters of Boningosson therapeutic pocketbook from the first to last. Okay, so that is why see here again they have asked the same area, like urinary organs area, where the first question was from Kent repertory, this question is from the BTPB repertory. Okay, so as I already dealt in the Kent repertory, it is alphabetically arranged. Okay, whereas in Boningosson therapeutic pocketbook, these chapters actually are arranged, divided according to the system. Okay, first you will be having the urinary system and then you will be having the female genitalia or the menstruation and lucorial related symptoms. Okay, so when you get back to the question, now you can easily classify it into 2 different groups. Okay, so initially we will start with the urinary system. Then arrangement is according to the female genitalia or leukorrhea and menstrual symptom. Okay, the answer is B, C, A, E, D. Okay, so first is the urine, then you have micturition, then you have sexual organs, then followed by that menstruation, then leukorrhea. Okay, so if you know the arrangement of the chapter, these type of questions are very easy to answer, and then again it will fetch you good number of marks when compared to your subordinates. Okay, moving on to next question. Which of the following repertory is not published by the Guernsey? As I already multiple times I have already told you that no, always read the question twice. So here what the question they have mentioned is, which of the following repertories is not published by Guernsey? Okay, so before we know what repertories he has published, we should know about who is Guernsey as well. Okay, so there are 4 options. Okay, we should rule out one repertory which has not been published by Guernsey. Okay, so this is a legendary Guernsey. His full name is Henry Newar Guernsey. Okay, so he was the first person who coined the term keynote. Okay, whatever we call it as keynote prescriptions today, it was coined by the Guernsey. Okay, Guernsey was the first person to coin the term keynotes. Okay, so he has contributed in the repertory field by publishing 3 major books. Okay, first one is a repertory of desires and aversion. It was published by Guernsey. The next one is repertory of hemorrhoids. Again it is published by Guernsey. And also I have called there is something called as repertory of mastitis. Again it is published by Guernsey. Okay, so all the 3 repertories are called as regional repertory. Okay, where you have related to some part of the body or some part of the disease. This is what we call it as regional repertory. So Guernsey has contributed quite a bit in the field of regional repertories. Okay, whereas the other option, repertory of the sciatica. Okay, so this was written by Alfred Pulford. Okay, so the right option is repertory of sciatica. Okay, so whereas the other 3 books have been published by Guernsey. Moving on to next question. What would be the correct arrangement of the symptom muscles refuse to obey the will when attention is turned away in Kent repertory? Okay, you have 4 options. So this is the rubric hunting question again, as I already told. Okay, so you need to identify the right rubric for this particular question. Okay, so here see there are 2 involvement. One is muscle refuse to obey the will, so there is affinity of the will as well as the muscle. Okay, so whenever this kind of question is always asked, okay, you should always jump on to the mind chapter, because Kent's repertory is known for mind chapter. Okay, so here there is a direct rubric: mind, will, muscles refuse to obey the will when attention is turned away. So here the single remedy is Helleborus. Okay, so the right arrangement is option 3, mind, will, muscles refuses to obey the will when attention is turned away. Okay, moving on to next question. Question number 7. Okay, at the initial part of this video I have already told that the 2 area of interest of the examiners or the question framers is one is Kent's repertory rubric hunting as well as the single drug rubrics. Okay, so here though they have not asked from the mind chapter, they have asked from a chapter head. Okay, so where you have yellow dandruff. Okay, it's a very simple, no need to convert it into any sub rubrics as such. It's a direct rubric. Okay, so under head chapter you have a rubric yellow dandruff. They are asking what is the single remedy mentioned in the particular question. Okay, so you have calichlor, meserium, calisulf and thuja. Okay, so here most of the time if you already know the remedy, it's well and good, because you have already gone through the repertory. You might have been coming across this rubric, because many of the time when some patients consult you with seborrheic dermatitis or there is a dandruff, you directly have a rubric to go and check with the what all remedies you have. So here see, thuja is also a common remedy for dandruff, meserium is also a common remedy for dandruff. Okay, so how do you differentiate? So the remedy for this particular question is calisulf. Okay, so this is the yellow dandruff and it's a single drug rubric. Here you can see the sub rubrics as well. Under head you have dandruff, under head dandruff white, head dandruff yellow. Under head dandruff yellow, the only remedy is calisulf. Okay, so it's a quite easy question if you have been aware of the Kent's repertory's arrangement, as well as if you are frequently using Kent's repertory. So this question becomes quite easy. And then moving on to 8th question. So this is a statement based question. Okay, so if you are already thorough with whatever statement you already known, then you can attempt this question, or else this will be a recipe. If you answer the question again, it will be a recipe for huge disaster, because you will lose one negative mark without knowing. If you try to answer the question, definitely, because the probability of getting the answer right is very low in this kind of question, unless and until you understand the subject very thoroughly and try to attempt it. Okay, so statement 1, the all drugs mentioned in the Kent repertory under chapter extremities, rubric heaviness, lower limb, exertion after A, okay, are mentioned in the first grade only. Okay, so what they are asking is, under the extremities, heaviness, lower limb, exertion after, all the remedies are mentioned in first grade or 3 mark. Okay, so let's verify the first statement whether it is true or wrong. Okay, so under the rubric extremities, heaviness, lower limb, exertion after, you have 5 remedies: conium, gelsemium, lachesis, picric acid and rustox. So as you can see, all the 5 remedies has been mentioned in the highest mark itself. Okay, or what we call it as first grade. So the statement 1 is correct. Okay, moving on to next question, moving on to next statement. All the drugs mentioned in BTPB under the chapter lower extremities, rubric patella, are mentioned in the first grade only. So similarly in the BTPB, see, this is a combination of repertory. This question is a combination of repertory, where the first statement is of Kent's repertory and second statement is of BTPB repertory. Okay, so whereas in the lower extremities patella, not all remedies are mentioned in the first grade only. Only belladonna, camphora is mentioned in first grade, whereas other remedies are mentioned in different grades. So the statement 2 is incorrect. Okay, so here the right answer is statement 1 is correct and statement 2 is incorrect. Question number 9. So this is a match the following question. As I already told multiple times, always try to attempt match the following question, because if you are able to figure out one match exactly, so there are chances of getting the questions very right, and it's quite easy also majority of the time, because options will direct you to answer the right option as well. Okay, say for example here under list 1 you have rubrics, list 2 is the meaning of the rubric. So this is the question based on which the rubric is given. You need to identify the right meaning of the rubric. Okay, so here there are 4 options. Okay, so you have mania apoto, mentagra, impertinence and impetuous. Okay, if you have already opened the repertory and if you are already thorough with the repertory, so this question is taken from BBCR. Okay, so and you have many older terminologies. Say for example mania apoto is there, so it is a Latin word for delirium tremens. So you can rule out directly. Option A is nothing but 3. Okay, so option A, if you are able to rule out one thing, like example mania apoto is delirium tremens, option A, and under list 1 for A option you have 3, and that is delirium tremens. So you are able to rule out the other 2. Option 2 and option 4 is gone, because you are very thorough with the mania apoto is delirium tremens. So you are only left with 1 and 3. Okay, even in this if you are able to rule out B, C, D, it is well and good. If you are not able to rule out that, then probably you can take risk in this kind of questions, because the probability of getting the answer correct will be 50%. See, and option 1 and option 3, again the D is 2. Okay, D2 in the sense impetuous is impulsive and hurried. So you are able to rule out 2 things, and if you are able to differentiate between B and C, then you might end up in answering the right question. Then so mania apoto is the Latin word for delirium tremens. Okay, so then mentagra. Okay, mentagra is a rubric given in BBCR, so it is the older terminology for barber seats. Okay, so if you are able to rule out 2 things, then you can directly answer this question, and the answer is A3, B4, C1 and D2. Okay, so moving on to 10th question. The only remedy mentioned in BTPB for aggravation from onion is. Okay, so as I already told, again this is a question based on single drug rubric from the BTPB from the aggravation. Okay, so the only remedy for aggravation of onion is Thuja occidentalis. Okay, so Thuja is the one remedy where there is aggravation from onion, and in the BTPB repertory it is a single drug rubric. Moving on to next question. The only remedy mentioned in Boninghosen therapeutic, so this is the only remedy mentioned in Boninghosen therapeutic pocket book for onion aggravation. Okay, so Thuja occidentalis. Moving on to next question. Again, this is a match the following question based on the BBCR. Here, the list 1 they have mentioned the rubric in BBCR, and list 2 they have mentioned the meaning. Okay, let's see what it is exactly. Okay, so this is the rubrics mentioned from the mind chapters of BBCR, and all the 4 rubrics are single drug rubrics. Okay, so here if you are able to rule out one question, one rubric exactly the reference, then it would be very easy. Okay, so for at least I know, like for mind communicative, the remedy is lachesis. Okay, see the option is also quite easy. A matches with 3, so the single remedy under mind communicative is lachesis. So option A 3 is there. Okay, so whereas the other 3 option it is ruled out. Okay, so these are the, see in match the following question majority of the time we should use the ruling out technique than trying to answer the entire thing. Okay, so here the answer is, it's a single drug rubric from mind chapter, and the answer is, for mind communicative you have lachesis, clothes destroy his, you have veratrum album, ferocity you have opium, mischievousness you have arsenicum album. So the right answer is option 3. Moving on to 12th question. The total number of drugs mentioned in characteristics materia medica part of Boger-Bonninghausen repertory are. Okay, so you need to mention the total number of drugs mentioned in the characteristic part of the materia medica. So read the question very thoroughly, because they have mentioned the characteristic materia medica part, how many number of remedies are there. Okay, as you know, this is the BBCR repertory. Okay, so they have mentioned in the highlighted yellow mark that there is characteristic as well as the repertory. So characteristics is nothing but the materia medica part, whereas the first part of the book is materia medica, and then you have the repertory part. The second part is repertory part. Okay, so here the question asked here was, what are the number of remedies mentioned in characteristic part of the materia medica? Okay, so the right answer is 140. Okay, whereas in repertory, that is why only the materia medica part question has been asked, how many number of remedies are there. So the answer is 140. Okay, moving on to next question. The only remedy mentioned in aggravation in Moonlight in therapeutic pocketbook. Again, it's a single drug rubric from the chapter aggravation from BTPB. Okay, so there are many single drug rubrics asked in AIAPGET 2022, especially from BTPB. Okay, so your area of interest will also be single drug rubrics from different chapters of all the 3 basic repertories. Okay, so the only remedy mentioned is anti-crude. So there is a separate chapter aggravation in BTPB. Under that direct rubric Moonlight is mentioned. Under that the remedy is anti-crude. Moving on to next and last question. The rubric aversion for dry food is found in which chapter of BBCR? So it's a question from BBCR. The symptom is given. We need to identify which chapter does the rubric belong to. So option 1 appetite, option 2 taste, option 3 stomach and epigastrium, option 4 conditions in general. Okay, so before we jump to the, whenever you study a rubric or whenever you study the chapter, you always try to compare with other 2 subordinate repertories as well, like BTPB as well as Kent. Okay, so here, okay, so in the appetite chapter, aversion to dry food is given. The single remedy is Merck. Okay, so I'll also try to compare with other 2 repertories as well. Okay, so in the BTPB, desire and aversion are given in hunger and thirst chapter. Okay, so this is the error with the PPT. Okay, so in stomach, in Kent's repertory it is given in the stomach chapter, whereas in the BBCR repertory it is given in the appetite chapter. Okay, I repeat once again, hunger and thirst, desire and aversions are given in hunger and thirst chapter of BTPB repertory, appetite chapter of BBCR repertory, and stomach chapter of Kent's repertory. Okay, so this is the right answer is appetite. Okay, so always try to understand the basics of repertory before you answer the question, and also try to read the question multiple times, and also see the options very thoroughly, because the exam is based on CBT, computer based test. Okay, so there are chances you may miss some certain words. Always try to read the question completely, options completely, and then try to answer. Okay, so this will be the end of this video. So you have come across 14 questions. from the AIPGT 2022 previous year questions. I hope this video was helpful, and thank you. Hello everyone, this is Dr. Kiran. Today I will be dealing with AIPGT 2023 repertory previous year questions. Okay, so before I jump on to the actual topic, okay, so there is something which I need to bring to the notice of all the aspirants of AIPGT 2024. So NTA has released the subject wise weightage in homeopathy for AIPGT 2024. Okay, so this is the most important aspect. So you get to know what subject is given, how much weightage in this examination. Okay, so dividing it into two broad aspects, you have homeopathic subjects and then the allied subject, or what we call it as pre and paraclinical subjects. So in the homeopathic subjects, 60 marks, 60 questions come from homeopathic subject. The rest 60 will come from the allied subjects. Okay, so under homeopathic subjects, materia medica carries 16 questions, organon of medicine carries 16 questions, repertory carries 16 questions, as well as homeopathic pharmacy will carry 12 questions. So these are the four subjects which can fetch you more number of marks and will help in fetching good seat in central as well as state government institutions. So moving on to the repertory part, so you have 16 questions in AIPGT 2024 for repertory, whereas today whatever I am dealing, so that is 2023 questions, previous year question, that has 15 questions from repertory. Okay, so before you start with the actual repertory portions, you should be knowing BTPB, of course it's Boning-Gosson therapeutic pocketbook, and then you have BBCR as well as the magnum opus of the repertory field, that's the repertory of homeopathic materia medica by Dr. J.T. Kent. It's also called as Kent's repertory. Okay, so moving on to the first question. So here this is a clinical question where the patient presented with complaints of burning in soles at night. So this is the typical presentation of the diabetes as well as vitamin B12 deficiency. So you need to hunt the rubric for this particular symptom. Okay, so this is what the patient is representing. So now you need to, so I have given in the symptom form burning in soles at night. So how do you convert it into rubric in Kent's repertory? So burning is basically a sensation or a type of pain. So the first rubric, what do you find is in the extremities chapter. Okay, so because his soles is burning, you need to see the extremities chapter. Under that you have a rubric pain. Okay, so under that you have a sensation burning. After that you have foot, then soles. Okay, and then the time modality. As you know, Kent repertory is arranged based on the STME pattern. Side is not given, so directly jump into the time. Under time modality, morning, afternoon, evening and night sub rubrics will be there. So here direct rubric is night. Okay, so then now you need to find the right option. Extremities, pain, burning, foot, sole, night. So this is the exact rubric for the symptom burning in soles at night. Moving on to next question. Again this same question has been asked from the Kent's repertory itself. Again the question is regarding rubric hunting. Okay, so again here, which of the following chapters have given rubric freckles? Okay, so under that you have skin, generalities, nose and mind. Okay, so you need to select the options according to the appropriate answer. Okay, so they have already given a rubric, you need to find the chapter in which the rubric is given. Okay, so by this question you understand that because in the option they are given A, B, C, D, A, C and B, D. Okay, so here it is understood that this particular rubric freckles is given in multiple chapters. So you need to know in which all chapters the freckles is given. So before we understand freckles, we'll see what is freckles. Okay, so freckles are flat toppy lesions where you have very prominent in the sun exposed areas. So here this is the picture of the freckles. You can see the freckles in the face as well as on the nose. Okay, so here in the Kent's repertory it's given in face chapter, it's also seen in nose, in general as skin. Okay, so directly jumping into the rubric, you have direct rubric face freckles. Under nose chapters you have freckles and skin chapters also you have freckles. Okay, so I have mentioned few of the 3-mark remedies under the particular rubric. So now what is the answer? You have it in the face, nose and skin. Okay, So here, since nose is not given in the option, so it's clearly ruled out. Sorry, since face is not given in the option, so face chapter is clearly ruled out. You only left with skin as well as nose. So in the Kent's repertory, you have it in the skin as well as in the nose. So the correct option is option 3, A and C only. Moving on to next question. Which of the following rubric from BBCR is not given in the mind section of Kent's repertory? So this question is basically a comparison between two repertories, that is BBCR as well as Kent's repertory. So you should know rubrics from Kent's repertory as well as from the BBCR repertory. The question is, there is some rubric in BBCR repertory which is not mentioned in Kent's repertory. Okay, you have 4 options: positiveness, playful, passionate and professing. So let's move on to Kent repertory first. Okay, so in the Kent repertory, the most important chapter is mind rubrics or the mind chapter. So under that there are rubrics like playful, pleasure, positiveness and professing. Okay, so you don't find the rubric passionate, but you find the rubric passionate in BBCR repertory. So under BBCR there is a chapter called mind chapter. Under that you have a rubric passionate, hasty temper. So this particular rubric is not found in Kent's repertory. So the answer is option 3, passionate. Moving on to next question. In which of the following chapter of therapeutic pocketbook prostate is mentioned? Okay, so this is a question based on a BTPB repertory and there are 4 options: urinary organs, urine, micturition and sexual organs. To describe it in brief, sexual organs deals with male and female genitalia related symptom. Micturition is something only with the urination, say for example involuntary urination, dysuria or painful urination. The rubric or the symptoms related to particular micturition is given in the micturition chapter, whereas in the urine, the character of the urine, odor of the urine is given. Okay, whereas in urinary organs, so the general idea of the organs has been given. So in the under BTPB urinary organs, you have kidney, you also have bladder related pathologies and you also have urethra. So this is not ureter, this is urethra. Under urinary organs you also have urethra, and then last but not the least, prostate gland is also given in the urinary organs. So the right option is option 1, urinary organs. Moving on to 5th question. Okay, so this is basically a match the following type of question, and match the following questions are quite easy because most of the options even suggest the answer for you. Say for example here, to my in the right side of the column you have rubrics and then towards the left you have BBCR. Okay, so chapters. So you need to identify the right rubrics and fit the chapter exactly. Okay, so here if you see the options, okay, so option 1, 2, 3 and 4, if you see the first one, homesickness, and majority of the given thing is 3. Okay, so 3 is homesickness is related to mind chapter. So easily you can rule out the option 3 where the homesickness rubric is given as the chapter 1, sensation and complaints in general. Okay, so I will be dealing with the individual rubrics. Homesickness is a person, is actual definition of homesickness is when a person is away from the home, he thinks of the home. So most of us might have been suffered from this kind of symptoms, right, whenever we are away from the home. So this is a mind symptom actually. So you have mind symptom, homesickness. So under mind chapter you have homesickness, and there was second rubric, lumbricoids. What is lumbricoids? So with your parasitology knowledge, you know that there are many worms, Ascaris lumbricoids, pinworms and other worms as well. So in BBCR, under stool chapter you have a rubric worms. Under that you have type of worms. So under that there is a sub rubric lumbricoids. Okay, so moving on to the next one. Next one was epilepsy, or what we call it as convulsion. Okay, so this is a in general process where there are many types of epilepsy: tonic epilepsy, tonic-clonic, absent seizures. Okay, so seizures, since there is general involvement of the entire body, it is mentioned in sensation and complaints in general chapter of BBCR repertory. Okay, even in Kent's repertory there is a rubric convulsion directly given in chapter generalities. Okay, ebullition is something related to circulation where there is bubbling or boiling of the blood. Okay, so the right option is option D. Okay, homesickness is seen in mind chapter, lumbricoids is seen in stools, ebullition is seen in circulation chapter, and epilepsy is seen in sensation and complaints in general. Moving on to next question, which of the following rubric is not mentioned in generalities chapter of the Kent's repertory? Okay, so this again generalities chapter is one of the important chapter in Kent's repertory. So there are 4 options: nursing children, old people, menopause, and stooped shoulder. Okay, so if you see nursing children, there is a rubric for children who are who are nursed by their mother. Okay, so you can consider it's a general symptom, right? So it's a duration of age, so you have it in generalities. Again, the old age. Okay, so complaints related to old age, if there are multiple complaints, you can directly consult the rubric generalities old age. And then stooped shoulder. So stooped shoulder, it's again based on the appearance of the person. So these 3 rubrics are in the generalities chapter. Okay, so stooped shoulder, again I have one single 3-mark remedy is sulfur. Okay, you might be listening to your Medica classes, your professor might have told that sulfur personality is very lean, thin, stooped. Okay, so again 3-mark remedy is sulfur. So all these 3 rubrics are seen in generalities, whereas menopause rubric is seen in the genitalia female chapter. Okay, so under menopause rubric you have it in genitalia female. So the right answer is menopause. Okay, and before I move on to the next question, always read the questions very thoroughly. So here if you see which of the following rubric is not mentioned in generalities chapter, so they have asked which chapter is not there in generalities chapter. So that is why the answer was menopause, because it was in female genitalia chapter. Moving on to next question, question number 7. Which of the following repertory in which abdomen is mentioned as the first chapter? Probably this was the most easiest question in 2023 AIAPGT. Okay, so here there are 4 repertories given. Synoptic key of the Medica, it is by Boger. Synthetic repertory by Barthel and Clunker. Repertory of Herring's guiding symptom of our Medica, nothing but the Knerr's repertory. Okay, and concise repertory of homeopathic medicine by SR Photak. So you know there are 4 repertories. Okay, so what we need to know is the arrangement. Okay, they have asked the abdomen. Okay, so abdomen is the first chapter in which of the following repertory? Synoptic key, again it's based on the Boger's ideology, so it also contain a Medica as well as a repertory. So synthetic repertory is based on Kent's philosophy. Again there the first chapter is mind, and then repertory of Herring's guiding symptoms of our Medica by Knerr. Again there the first chapter is mind and disposition. So and the final rubric, option is a concise repertory of homeopathic medicine by SR Photak. Okay, you might be knowing the famous Photak's repertory. So here this is the repertory. Okay, so a concise repertory of homeopathic medicine, and if you see the tagline, it's mentioned alphabetically arranged. Okay, so whenever it's alphabetically arranged, so here there are nothing like the chapter as such. So the rubrics are arranged in an alphabetical order. And one more example for a alphabetical repertory is Murphy's repertory. Okay, so the right answer is option 4, concise repertory of homeopathic medicine by Dr. SR Photak. Moving on to next question, which of the following rubric is not given in the section of face chapter of Boningossen's therapeutic pocketbook? So this is a question based on BTPB. You have 4 options: calm downs, and then yellow saddle across upper part of the cheeks and nose, and third option is drawn, and fourth option is parotid gland. Okay, so whenever you see such kind of question, you should be really smart to answer it. Okay, so for example, so this is actually the easy question if you know the particular aspect of the repertory. Okay, so in the BTPB chapter, see now you can't master all the rubrics for AIAPGT. To know each and every rubric will be little difficult. Okay, and it's actually impossible also. Okay, so in the whatever less time span is left, you need to be little smart. Okay, so in BTPB there is something called as misplaced rubrics. Okay, misplaced rubrics. Misplaced rubrics of BTPB should be known in hand. Okay, you should be very thorough with BTPB misplaced rubrics, because every year they have been asking the same question very repeatedly. So under misplaced rubric, parotid gland has to be given in the ear chapter. Okay, so the question what they have asked was which chapter is not given in the face chapter of the BTPB. So the right answer is parotid gland. Okay, so you need not be confused with no all the three rubrics, all the three options given in the BTPB. So if you know the direct misplaced rubric of the BTPB, directly you can answer this question. Okay, moving on to ninth question. Tendo Achilles is mentioned in which of the following section of the therapeutic pocket book? Again the question is from BTPB. So there are four options given: lower extremities, sensation, skin and aggravation. So in general, tendo Achilles, or what we call it as Achilles tendon. Okay, so you know the anatomy, right? You already studied anatomy, and you know this is the tendo Achilles. Okay, so Achilles tendon again, it's a combination of gastrocnemius as well as soleus muscle, where it gets inserted in the calcaneal bone, in the posterior aspects of the calcaneal bone, right? So the Achilles tendon itself is related to the lower extremity. So in the BTPB, this is a very easy question as well. So the direct answer is lower extremities. Moving on to next question. In BBCR, under the aggravation and amelioration in general chapter, which of the rubrics is mentioned? Okay, so again A, B, C, D, four options are been given: influenza, uric acid diathesis, hemophilia and anemia. So under that you should arrive at the appropriate option. Okay, option is A only, B only, C only and D only. So BBCR, as you know, the unique feature of BBCR repertory is the pathological generals. The rubrics related to pathological generals are given in a chapter called as sensation and complaints. Okay, so this is the BBCR repertory. So in that there is a chapter called sensation and complaints, which is very unique, where the pathological generals are being given. So here in the options, if you see, influenza, uric acid diathesis, hemophilia and anemia. Anemia, influenza and hemophilia, actually they are mentioned in sensation and complaints chapter of BBCR. Okay, so but there are exceptions. Pathological general, there are two pathological general which are mentioned. Actually it's a misplaced, but it is mentioned in aggravation and amelioration chapter of BBCR. Okay, so two other rubrics are uric acid diathesis and senility. Okay, so though they are pathological general, they are by mistakenly mentioned in aggravation and amelioration chapter of BBCR. So the right answer is uric acid diathesis, option 2, B only. Moving on to next question. Question number 11. In Kenn's repertory, the cross reference given for the rubric resolute is. Okay, so this is kind of a direct rubric where you need to know the cross reference of many mind rubrics in Kent repertory. It is mentioned in, it's very clearly given in Shashikant Tiwari. There are very few rubrics, but if you are able to recall it, that will be very helpful for AIAPGT 2024. So you have remorse, repulsive, courageous and careless. Okay, remorse is kind of a guilt feeling. Okay, so again that is not the cross reference for resolute. And repulsive is something against the authority, so that is what we call it as repulsive. Careless is heedless, so where there is lack of there is, for careless there is a direct cross reference, heedless. Okay, so that means there is no seriousness and there is lack of care. Okay, and for this question the answer is courageous. Option 3, courageous is the answer, and this is the confirmatory cross reference for resolute rubric. So there are two types of cross references. One we call it as confirmatory cross reference, that means after the rubric the remedies are not given. So those type of cross reference are called as confirmatory cross reference, whereas after the remedies, after the rubric, if there are remedies given, those kind of cross reference is called as comparative cross reference. So question number 12. In the context of generalities section of Kent's repertory, which of the following rubric is given when too much medicine has produced an oversensitive state and remedies fail to act? So here they have mentioned the Kent repertory and also the generalities chapter. They have asked you to hunt the what is the exact rubric for the below mentioned symptom. Okay, so here there are 4 rubrics, 4 options: heaviness, lack of vital heat, weakness, irritability. Okay, so heaviness is kind of ruled out because you can't tell that no drug overdosage is little heavy, so that's not the right terminology. And lack of vital heat is the rubric actually for the chilly patient, to see whether the patient is chilly. So the rubric for the chilly patient is lack of vital heat. And weakness, in general you have generalities weakness, direct rubric is given. Okay, so it has no association with the medicine oversensitivity production and whenever the remedies fail to act. The last rubric is irritability. Okay, so the right answer here is, I will show you in the Kent repertory where actually it is mentioned. Okay, under Kent repertory generalities chapter there is a rubric irritability when too much medicine has produced an oversensitive state and remedies fail to act. There are 2 remedies, phosphoric acid and teucrium. So teucrium, TMV you might be knowing, teucrium marum varum. So 3-mark remedy is teucrium. Okay, so most of the time you rule out irritability very easily because you think it's Kent's mind rubrics is considered to be irritability, but here the even in generality section there is a rubric called as irritability, whereas this is physical irritability due to the overreactions of the oversensitive state of the drug, and whenever no other remedies is acting because of the oversensitiveness produced by the drug, the remedy of choice is teucrium marum varum. So it's in 3-mark, very thoroughly verified as well. So this is option 4 is the right option. Moving on to next question, question number 13. So this is a statement based question. Okay, so and these questions should be attempted very carefully because there are 2 statements, and if you have confusion in one or if you don't know both the statement, better to quit these questions because the probability of the answer getting correct is very low if you don't know the entire concept. So you need to know the concept of Kent's repertory very thoroughly for this particular question, where the statement 1 is general rubric will include all the remedies that are related to the symptom. Okay, and the statement 2 is under rubric itching of the palm there are number of remedies, but anagalis is not included, though in sub rubric itching palm rubbing ameliorates anagalis is mentioned. Okay, if you don't know anything about the skin itching of the palm, or also in the extremity section if you have not seen the rubric and if you don't know the remedy anagalis, better not to answer this question. Okay, so if you know the statement 1, see general rubric will include all remedies that are related to the symptoms, so that is right. Okay, statement 1 is right, and statement 2 if you have confusion, if your risk appetite is very good, then you can give a try for this question, but again the probability, if you know only one statement, the probability of getting answer correct will become low, so it will become less than 25%, whereas if you know both the chances, then whenever it's 50% there is yes or no. There is only one question, 1 mark will be deducted if the question is wrong, and if you get it correct, then you will be benefited with 4 marks. Okay, so here the answer is both statement 1 and 2 are correct. Okay, so for this you need to refer Kent's repertory extremity section for further detailing where the subrubric itching palm rubbing ameliorates anagalis is mentioned. Moving on to 14th question, given below are 2 statements. Again similar question from Kent repertory where you have 2 statements. Okay, so this is the pattern of AIAPGT question, because unless and until you know the subject very thoroughly, it becomes really difficult to answer these questions. Okay, so in generality section of Kent's repertory, in the rubric undressing after aggravation, medicine rubrics is not mentioned. So let's get back to Kent's repertory and see under generalities chapter. Okay, so under Kent's repertory generalities chapter, undressing after aggravation, you don't find, you have rustox, you have pulsatilla, you have sepia, you don't find rubric, you don't find the remedy rumex. Okay, so here the statement 1 is correct. So and the next statement was in the generality section of Kent's repertory, the rubric vaccination after antim-tart is not mentioned. Okay, so we'll move on to the generalities chapter again to check whether this rubric is right or wrong. Under generalities chapter you have a rubric vaccination after, there you have epis, you have arsenicum album in the A series, whereas you don't have antim-tart in this section. Okay, so even the statement 2 is correct. Okay, so the right option is both statement 1 and 2 are correct. So for these kind of questions to answer, you should really know repertory in depth, then only you can answer this kind of question. But at least if you know one question or one statement right, then you can try answering this question, or else it's better to quit this question. Moving on to the last question, which of the following chapter of Kent's repertory? Again the question is from Kent's repertory itself. You will find the rubric coffee amelioration. Okay, so under that you have mind, stomach, mouth and generalities. Okay, so these are the 4 chapters they have given. We need to find coffee amelioration. Okay, so which chapter, any guess, because these kind of questions are really tricky and guessworks may lead to fatal results. So here there are many rubrics or many sub rubrics where there are coffee amelioration. Okay, but in the question, if you look back the question, they have very clearly mentioned that it's just a coffee amelioration and no symptom is mentioned. Okay, no particular symptom is mentioned. But in Kent's repertory regarding coffee amelioration, there are many rubrics. You have mind confusion, which is better by coffee, and there are head pain, which is better by coffee, and stomach pain better by coffee. You have remedies like colocin for this particular rubric. But in this question they have asked coffee in general amelioration. Okay, so the right, if you see Kent's repertory, under generalities there is a rubric food, coffee amelioration. So here you have 3 mark remedy chamomilla. So the right question or the right answer for this question is option D, generalities. Though you have in the mind chapter, though you have coffee amelioration, so it is only the confusion is better by coffee, and even the stomach pain is better by coffee. Okay, but here the question is very precise that they have not mentioned any particular symptom. So that is why the answer is option D only. Okay, so that is it's seen in generalities chapter, food, coffee, amelioration. So these were the 15th question which I have tried to deal with AIAPGT 2023. I hope this was very useful, and always try to go back to previous year questions, see the questions, always solve it, because there is a tendency of AIAPGT 2024 to ask such kind of previous year questions very repeatedly, and nearly out of 120 questions there are 5 to 10 questions getting repeated, and in some year there is also a tendency to get 15 questions as well. Okay, and always be thorough with the repertory chapters, and also go through the years editions as well as the year of publication of the repertories and different types of repertories. Okay, but the recent trend what we are seeing is the in Kent's repertory, though it's even in BTPB as well as BBCR repertory, the majority of the question, okay, even in 2023-22, so the majority of the questions have come from rubric hunting. Okay, so you need to know the chapters in and out, especially Kent's repertory, BBCR and BTPB. Okay, so I hope this session was useful, and thank you all.